About 20 million Americans suffer with nasal obstruction, or the feeling of not being able to breathe through their nose. And so today we're on your side with Dr. Christopher Davis, the president of Excel ENT of Alabama, in studio to help us out. How you doing, Chris?
Doing well, doing well.
So when I say nasal obstruction,
what
am I talking about there?
Well, the inability to breathe through the nose. A lot of folks have that. Sometimes they have it all day long, throughout the evening as well. But there's some folks that have a difficult time breathing through their nose at night when they try to sleep or while exercising.
Yeah. What can cause something like this? There are a variety of things.
Sure. I mean, the classic thing is to think about septal deviation. That's what everyone kind of goes, towards. But there are certainly other structures in the nose as well that can contribute to nasal obstruction, or that feeling of the inability to breathe through the nose. There are little shelves in our nose called turbinates and septal swell bodies that can expand. They're normal structures, but they supposedly warm and humidify the air. But when they expand, it can cause nasal obstruction. And there's another little often forgotten area called the nasal valve,
right,
that can sometimes collapse and cause issues with nasal obstruction.
So when it comes to treatment for stuff like this, is there something new that's out there that can help people out?
Yeah, I mean, the classic things that I think people resort to are the nasal sprays,
right,
like nasal steroid sprays, Flonase, Nasonex. But yes, there are procedures that we have in our office that we can combine either with traditional surgeries like septoplasty, or avoid the operating room and actually use this device that you're seeing here called Vivere, which is made by a company called Aaron. And you can use these devices in the office and actually treat these nasal obstruction areas in the office.
So this is a little different than saying getting some sort of surgical repair done.
Correct.
Take us through that.
Yeah, so this is a minimally invasive procedure. It uses radio frequency technology. And essentially it's almost kind of like a dental procedure.
Okay.
The procedure time takes about anywhere from 30 to 45 minutes.
Right.
I tell patients the most amount of time we're going to spend in your nose is actually numbing up your nose, kind of like the dentist, who numbs up the tooth when you're doing a dental filling. And so we're going to numb up the nose, and then once that's done, the procedure itself takes somewhere between 7 to 10 minutes.
Okay, do you have immediate improvement?
Initially you will, that first day, I call it the honeymoon time, but it is surgery, so you're certainly going to have some inflammation in your nose afterwards. There might be some crusting in your nose, so there's some things that we can do to kind of mitigate that using some saline sprays. But your sweet spot is going to be somewhere between 4 to 6 weeks after the procedure. That's when you're going to start noticing some significant improvement.
How long lasting is that?
Well, Aaron has done some really good studies looking at this. I mean, surgical data, traditional studies are usually somewhere between a year or 2 years, but actually Aaron has looked at this study for up to 4 years. There's a study called Pivotal that showed 4-year response rates, which is pretty impressive.
Okay,
yeah.
So if people are interested in seeing this and going, hey, this may be a way that I want to be treated, how do they go about doing that with you?
Well, you can call, look on our website, Excel ENT. You can call our office, 205-988-6858. I'd be happy to see you, take a look inside the nose and see if these factors that we're talking about actually contribute to your problem.
Very good deal.
Yeah.
Dr. Chris Davis right here. We appreciate it with Excel ENT of Alabama. Interesting information there. We appreciate it, and we appreciate you for watching. But hey, we still got 30 more minutes coming up right here on WBRC 6 News and Noon. Stay with us.